I'm going to do a paraffin bath treatment on my patient. So this patient has osteoarthritis on her right hand. So the goal of treatment is going to be to increase her pain threshold and so the passive treatment, it will then allow for more active treatment. And this modality, the paraffin bath, is appropriate for this patient because one, the increased pain threshold will occur from the tissue temperature rise that the paraffin bath will provide, and the passive treatment allowing for the active treatment, so that doesn't require a tissue temperature rise, and if we increase her pain threshold, then she'll be able to do more later. So we're doing this paraffin bath at the beginning of treatment. And then the patient has no contraindications or precautions to the paraffin bath. The patient has had a paraffin bath before and nothing has changed since then. They have no circulatory impairments, open wounds, or cancer. This is our makeshift bath. We have it currently filled with water, but it will be filled with paraffin, which is 6 to 7 parts paraffin and 1 part mineral oil, so you can make it at home. And the container that it's in is heated, and you want it at a temperature of 118 degrees to 126 degrees, less than 100, and that's Fahrenheit. Less than 120 degrees, the wax may not melt. So you should do a temperature check every day. And you're going to start with your patient. So here's the extremity that we're going to put in the water. So I've taken off all the jewelry, and then I've inspected the area to make sure that there are no cuts or anything. And she has already washed and dried her hand thoroughly. So we are going to do the dip wrap method. So Sammy, with your fingers apart, I want you to dip your hand into the paraffin and try not to move your fingers, because that's gonna make it, and then you can pull it out and keep it there. And we're gonna wait just briefly. You can dip it back in. So when you bring it out, you're waiting briefly for the wax to become a little opaque and dry, and then she's gonna re-dip about 6 to 10 times, each time waiting for it to dry. And when she's doing this, we don't want her to touch the bottom or the sides of the container because those are going to be pretty hot. Okay, so she's completed the dipping. So we're going to move that out of the way, and we're going to wrap it. And you can wrap it in a bag or some wax paper or like treatment table paper. And then after you wrap it, you want to place a towel around the area, just so that you're not losing the heat as fast. So it's acting as the towel is acting as an insulator. And then we are going to elevate her extremity, just like that. And then she'll sit there for 10 to 15 minutes. And again, she's gonna try just to not move her hand at all. And then when you take it off, so it's been 10 to 15 minutes, you just pull this off. And then a lot of times what you'll see in the clinic, the wrapping will come off easily with the paraffin. You just kind of like slowly pull it back and roll it all up, and it should come off.